Today we're going to be talking about how parents promote healthy, age-appropriate feeding. The development of healthy eating behavior among infants and toddlers depends on both the provision of age-appropriate food and on responsive feeding practices by parents. Nutritional recommendations that focus only on food and not on the behavioral aspect of feeding ignore the major role which both the child and parent play in the feeding process. What is responsive feeding? Responsive feeding simply means that there is a level of reciprocity between child and parent during feeding. During their first year, both infants and parents begin to identify and interpret both verbal and non-verbal signals from each other. The ability of a parent to recognize and respond to verbal and non-verbal feeding cues from their child forms the basis of responsive feeding practices. Responsive feeding can be described in stages. First, parents provide structured and pleasant meal environments for their child. Second, the child is encouraged to communicate feeding cues of hunger or satiety. Third, parents respond in an appropriate manner to these cues. And finally, children learn to expect consistent responses from their parents. Responsive feeding practices have shown several benefits, including promoting children's interest in feeding, increasing their attention to their own cues of hunger and satiety, allowing them to effectively communicate their needs to their parents, and to progress successfully towards independent feeding. In short, responsive feeding is having the ability to recognize a child's verbal and non-verbal cues and to respond to them in an appropriate way. A child's demands are not always complied to, but are acknowledged in a supportive and firm environment. What is non-responsive feeding? Non-responsive feeding is characterized by a lack of reciprocity between parent and child, where a child's cues are overridden, overindulged, or ignored. This can take several forms. Firstly, controlling or dominant feeding. This is when parental concern over their child's intake leads to their need to exert control over the pace of meals, the volumes eaten, and what is eaten. This creates a pressured environment for children in which meal times become about performance. As a result, meal times become stressful for both parents and children. Children's internal hunger and satiety cues are overridden, and emergent feeding independence is hampered. The second form is indulgent feeding. This is characterized by parental responses that indulge a child's every request, even when inappropriate. For example, parents who respond to their child's cries by offering treat foods teach their children that crying is an effective means of eliciting their favored food. This feeding style lacks firm and supportive parental boundaries. The last form is uninvolved feeding. This feeding style is characterized by a parent's lack of attention to their child. Children, as a result, resort to inappropriate behavior to attract their parents' attention, such as food refusal or throwing food. So what are some of the strategies which promote responsive feeding? The first is to establish a routine. Toddlers and young children respond well to a feeding routine, which includes 3 meals and 2 small snacks per day. Parents can aim to offer meals and snacks at similar times, in similar settings. In this way, meal times are predictable and are given when children are neither too tired nor too hungry. Number 2. Provide a comfortable seating. Parents can ensure that their child is comfortably seated in an age-appropriate chair, preferably with a tray or table in front of them. In this way, children are able to visualize and engage with the food on offer. The third point is to remove distractions. Distractions must be minimized as much as possible. This includes TVs being turned off and toys being put away. In this way, children can learn to communicate to their parents during their meal times, take note of what they're eating, and to be mindful of when they've had enough. The fourth point is to persistently offer a variety of age-appropriate foods. Over time, it's important to progress infants and toddlers onto foods of different textures and tastes. Ongoing, persistent exposure to a variety of healthy, age-appropriate foods will encourage acceptance of these foods over the long term. However, these foods cannot be forced on a child. They must simply be offered on an ongoing basis. The next point is to encourage mess and self-feeding. Infants and children need to be provided with the opportunity to engage with their food. In this way, mealtimes become more of a proactive activity rather than a passive one. Touching, making a mess, and attempting to self-feed increases interest in food and makes mealtimes seem more appealing. The sixth point is to share family meals. Shared family meals are an essential part of developing healthy eating behaviors among children. Infants and toddlers learn by watching their parents and siblings, and they need to be offered the opportunity to do so. Shared family meals exposes little people to a relaxed, social mealtime environment in which their parents model the behavior that they are gradually learning. Wherever possible, parents can plan as many meals a week where the whole family can eat together. And the last point is to be mindful of your child's cues. Parents need to respond promptly to their child's cues during meal times. If children turn their head away, close their lips, become unhappy, or appear disinterested, they've had enough. Very little benefit is gained by trying to persist beyond this point, and the meal should be stopped. Children develop a sense of trust in their parents and in the mealtime environment if their satiety cues are responded to without more food being forced upon them. Let's recap on the strategies which promote responsive feeding. Establish a routine. Try to provide comfortable seating and remove distractions. Offer persistent exposure to a variety of food and encourage mess and self-feeding. Share family meals and be mindful of your child's cues during meal times.